My mom has been probably out of the dentist for maybe the last 5 to 10 years. She has pretty bad anxiety when it comes to coming to the dentist.
Okay.
And she just kind of let her oral health slack a little bit.
Okay.
She has a couple missing teeth, and I have a suspicion that she might be at the point of either needing, I think it's called a partial or a denture. I'm not quite sure the difference between the two.
Okay.
But I think it's getting to that point. Could you give me a little information on that? I would love to bring her in to see you guys for a consultation.
Sure. A couple things. First of all, we have a lot of patients that are anxious, and so we really bend over backwards to make sure that they feel comfortable. So whatever your mom's concerns are, we'll take some extra time at the beginning to make sure she's comfortable. Usually the way we approach it is to have them come in just for a checkup cleaning. We assess their medical history, their dental health, the health of their gums. We see one of our hygienists. They evaluate all the gums and all the teeth, and we get the overall picture of where they are. And then we start talking about treatment options in terms of helping them restore their teeth to what they used to be.
Would she be able to keep some of her teeth and maybe do something where it's removable?
Very possible. What we'll do when we evaluate the teeth and see what kind of shape they're in, we'll see where she is, what she has, what's salvageable. If there's some that are not salvageable, then we'll address that. Many times there's a lot of different options between bridge work and implants and partial dentures and dentures. A lot of it has to do with what her overall health is and what the health of her existing teeth are. Patients that have multiple missing teeth will want a partial denture, one that kind of clips in and out. That's a less expensive option than bridge work. Another is if they have no remaining teeth, a full complete denture. What we find is that while we're good at making them, a lot of patients don't like them. They do them because they have to, not because they want to.
Right.
And so what that leads us into is the next step, which is an implant supported denture. This is what one looks like right here.
Oh, awesome.
Yeah, so you have a denture, okay? If we have a denture, they tend to flop around a little bit.
Right, and that's what she's worried about. She's worried about them kind of coming out of her mouth while she's eating or talking.
You try to use adhesives and things, but they're not that great. So what we do is we place some implants. Here's a couple in here.
Okay.
Okay, and then inside the implant are some little snaps. Kind of like O-rings, just little rubber snaps. And they snap onto the metal bases. And so instead of it flopping around, it snaps right into place, okay? And then it's held very firmly. And what we find is that patients with dentures that have implants, the amount of confidence is just light years better. They can chew much more vigorously than with regular dentures, and they look great.